Welcome to AP Leadership Podcast. I'm your host, Al Pilong, CEO of AP Leadership Partners, an executive coaching practice centered around a passion for effective leadership. There are two things I know for sure about leadership. First, leadership is hard. And second, leadership matters. And so my hope today is that through the course of this conversation, you will find fresh ideas and inspiration for your challenging but important leadership journey ahead. Thanks for listening. The AP Leadership Podcast is sponsored by CXO Coaching, an executive coaching firm focused on empowering leaders and driving results. And now, let's get started. Welcome to AP Leadership Podcast. Today, I'm honored to be joined by Dr. Pam Oliver, Executive Vice President and Chief Medical Officer for Novant Health. As a physician leader, Dr. Oliver helps guide clinical strategy, quality, culture, and patient care across one of the nation's leading healthcare systems. She is a board-certified OBGYN, a passionate advocate for maternal and child health, and a leader whose work has impacted communities and patients, and I would say team members far beyond the walls of any single hospital or clinic. In our conversation today, we'll explore leadership through the lens of courage, difficult decision-making, transparency, and the type of leader we aspire to become. Pam, welcome to the podcast. It's great to have you on. It's good to see you again. Before we jump into leadership, maybe tell us a little bit about yourself, Pam Oliver, beyond the professional title, Pam Oliver, the person.
Well, thank you, Al. First of all, thank you for inviting me to share this platform with you today. I really, really appreciate it. It's good to catch up with you also after working with you many years ago.
Yes, indeed.
This is wonderful. So, a little bit about me. So I am I'm an OBGYN physician by training. I'm a child of rural Eastern North Carolina. So I'm first generation college student, first physician in my family. I'm a Tar Heel, born and bred at Chapel Hill for undergrad and med school, and did my master's of public health because I saw healthcare potential through a lens of community and populations as much as individual care. So, my passion really is about helping each and every patient receive the care that they deserve to have the best outcomes, and doing that, supporting our teams that take care of those patients.
Well, very good. I enjoyed the opportunity we had to work together for a few years, several years ago, and always appreciated and admired your leadership, your approach to the way that you handled, challenging situations, difficult environments. And so let's start with a conversation about leadership and the kind of leader that you aspire to be. We all know that leadership's a journey. We never arrive. So we're always growing, and I know you are. So what type of leader do you aspire to be?
I really hold true to being a servant leader, right? Someone who holds the mission at the core and focus of my day-to-day work and in leading our teams. And in being that servant leader, being grounded, but also transparent. We were chatting before we started about, specifically being in healthcare where systems are challenged and we often have to make difficult decisions. And we have to do that at the bedside as much as we do in the C-suite. And being able to be that servant leader helps me to put that mission in the center of our conversation so that we can get to the best answer for us at the moment by having deep, difficult, transparent conversations. But in the end, knowing that our why and our mission always stays there. And that's what drives me. I think it's not the titles or recognitions. It's really about the impact that I'm able to have, whether it's one-on-one in an exam room or at the population level. That's what drives me. And so that, leaning into that servant leadership and making sure that I am thinking about all, not just subsets of our patients, subsets of our team, but everyone and how we can achieve the best outcome.
Yeah, there's a lot of conversation, a lot that's been written about servant leadership. Maybe just a little bit more about what that means, that idea of being a servant as a leader. What does that mean to you?
Yeah, well, to me, I feel that it is a privilege for when I'm one-on-one with patients, that patients choose to come to me and allow me as an OBGYN to be part of their birth journeys, right? That is the most amazing time in families' lives, right? To bring a new being into the world. And to be part of that, I thought was always very special. And as a leader, I think I try to lean into and make sure my teams are always appreciating the privilege that we have to be able to have a platform, to be in leadership, to help drive decisions that are for the greater good. It really is about what we can achieve and do for our patients and our community. So for me, we often talk with my teams about and our physicians about tapping into your why. So when you go through tough times, why am I doing this, right? Of
Yeah,
course,
yeah,
we do our jobs for paying our bills. We do it because the recognitions are nice. But in the end, we find that our resilience comes through and our success comes through really thinking about how we can serve either our patients or serve those who are serving our patients. And that's really what my leadership, I feel, brings to the table.
yeah. I do like the word privilege. Being in healthcare, it is a privilege, and, if you keep that mindset, you keep the why in the forefront, it really does help you be more effective. All right, maybe share with us a favorite book on leadership that sticks out to you and why.
Yeah, well, I would start with, I do consider myself a scholar. Like I lean into curiosity, learning. I've always been that way. I felt like there was a period of time when my children were young, when all I read was Dr. Seuss and children's books and did charts. Then
Yeah.
did my charting. And then as I was able to lean more into, getting back into reading, I read a variety of books that are either leadership. I also lean into history. I balance it out, right? Because I do believe that, history or so books about society, et cetera, are really important. But when I'm leaning in leadership and I read the traditional John Maxwell, love those types of books. Listen to podcasts like Mel Robbins, and some of her work. But I really like Brené Brown, and I've enjoyed. I think I've read almost all of her books at this point. But Dare to Lead. Dare to Lead is one that stands out for me. And what Brené does in that is she really reframes what courage and vulnerability are when it comes to leadership. And that it is not about an absence of fear. It is not about avoiding difficult conversations. It's not about armoring yourself so that you can get through the fire, more easily and the tough times more easily. But it was really about leaning into vulnerability as a form of courage. And so I think that's important for me because, you know, showing up in the moment, that bravery of showing up in the moment is important. We have to do difficult things, make decisions on the spot. But for me, that courage and leadership is about being willing to have difficult conversations, being truthful with people because they deserve that, leaning into inviting others into those conversations and not shielding them from that so that we can get to the best answers. And that's been a journey for me because, as an individual physician, I feel the need to come up with the right answer, right?
Yeah,
I'm
yeah,
expected to know the answers and make the decisions and lead the team in that way. But when leading a team as I do now, I need to invite all of my team to contribute. I need to prepare them and allow them to understand and not shield them from the difficult realities of where we are, but to invite them into that and give them honest feedback so that they can evolve and grow. And ultimately that makes me a better, more efficient leader when I'm able to pour into them in that way and they feel valued.
yeah. I love the combining of courage and vulnerability. Talk about how those 2 go together, vulnerability and courage as a leader.
Yeah. Well, so I mentioned I have children. I'm a mother of three, and my youngest is soon to be 18, and my twins will be 21. And I've had this life journey as a female physician leader that is unique. And I would say that some might think that the best solution is to always present this. I've got it together. I have all the answers. I figured it out, right?
Yeah, yeah,
I feel that there is courage that I need to show, and I often show to my teams by leaning into the vulnerability of what it looks like to try to balance all of that, right? and that I don't always have it right, and that there are many things I question about how well imposter syndrome, how well am I doing, either or. And in doing that, I feel that it engenders the teams to be willing to open up. It helps them to appreciate that I really do care about their well-being, and I understand that I want all of them to be able to have a healthy home life and work life. And so just one example of how I think, some would shield. They feel like you totally separate personal and work. I don't overshare. I don't feel like I need to, commit too much or to my team, but the appropriate amount of vulnerability so that they know, this isn't about perfection, right?
Yeah.
That
Yeah.
we're all a work in progress, and that includes me. And I understand when they may falter or they have different needs that they need to balance.
As a leader, it's tempting to feel like you always have to have all the answers. People are looking to you. All right, you're the EVP, you're the chief medical officer, so you ought to know, right? Well, leadership is about people and relationships, and it's messy sometimes, and it's not always clear. The answers aren't always clear. Well, let's talk about hard decisions, hard leadership decisions that often need to be made. Maybe employees or team members don't understand, or maybe even not happy about. Leadership. Sometimes you have to make tough calls. So tell me about tell me about that from your perspective.
This is a day-to-day dilemma for us. There are numerous challenges I think we face and we have to navigate. Well, I think that first it's helping our teams to appreciate that there is such complexity that makes some decisions not make sense on the surface, but trusting us with it. Resource allocation is always one of those. Those don't always seem right to our team members, and so we have to continue to lean into making sure we're balanced and that we are being the best stewards of the resources. So then when we have to make those difficult decisions, people see it. And of course, personnel decisions. There's a lot behind why someone may work out or not work out in an organization. And people often want to know all the details. Why? Because it makes them feel insecure or vulnerable, maybe. And not being able to share that out of respect for the person is difficult for people to get through.
Yeah. You said something early in your answer there about the team having to trust us to make a good decision or make the right decision. How do you build that trust so that even if the decision is hard or it's not something that the team might agree with necessarily on the surface, how do you build the trust so that people can move on when a difficult call has to be made?
Part of that trust is relationships and communication and transparency. So one thing that I do with my own teams is we really focus on how are we communicating in a way constantly, not just when tough things come up, but how are we building relationships through rounding, by being present so that people know us, by engaging all levels of leadership in conversations so that when something's made, it's not like, well, they made it. We all have some accountability to it. To, so it is a little bit about building those relationships continually so that you do get the benefit of the doubt in some cases. And then as we communicate, we have to lead with the transparency of what may be happening. The clarity matters and the transparency matters. And then keeping people updated continually, not just when the bad
Yeah.
news happens.
Let's talk about bravery and confidence and how they play into good leadership.
I mentioned earlier as a physician, I need to be confident. I need my patients to see my confidence in what is happening. Same thing with leadership. I need people to see that I am confident in the team that I built, the decisions that we're making, and in our plan and strategy overall. But confidence does not mean having all the answers and perfection, as I
Yeah.
mentioned, right?
Yeah.
And so I do think that's something that can derail leaders is that the higher you get in an organization and leadership, the fewer decisions you're actually. We should be developing strong teams. We should hire good leaders and let
Yeah.
them tell us what to do versus us, saying, I made this decision and being proud of that or that being where we get our value. So, I think that there's a difference between having all the answers versus trusting our people to figure it out. And bravery for me is about in the moment being able to work through fear, discomfort, to get to a good decision. Sometimes we have to look at data and we have to acknowledge where we're not getting it right. We have to have tough conversations with individuals or teams or about systems change that may be needed that can impact people feeling like they're being judged. If we don't do that, we don't move forward. We don't make progress. The tension that there sometimes is in this whole idea of valuing people, but at the same time leaning into those difficult conversations so that they can grow and we can grow as an organization. And there's a book, I didn't mention this one, but years ago our team read Radical Candor.
Yes, I remember that book.
And
Yeah.
Radical Candor, one of the principles in there is that, how candid you are with someone and the feedback you give is based on how much you care and how much feedback you give. So in this, like, if you had a little grid,
Yeah.
and it's like, I care deeply, and therefore I'm going to give you more feedback is the sweet spot because that's the only way that you grow versus I really don't care and I'm not going to give you feedback. I'm ignoring it. And that's benign neglect. Right.
Mm,
And
mm.
so I really feel like, as if we're, our people are our strength. That is, whether it's our patients or our teams. And so bravery for me is leaning into those difficult conversations that we have to have and allowing people to get the information they need to continue to thrive and grow and ultimately produce the best outcomes for our patients.
Yeah, I love that. Leaning into bravery when things are hard, having a conversation that you'd rather not have. And in the end, if you do it out of a true sense of caring for the other person, the outcome is likely to be much better, even if it might be difficult in the moment. So as we wrap up here, I appreciated your insights. Is there a leadership thought that you'd like to leave with the audience?
I think you said this earlier. Leadership is a journey and not a
Yeah.
destination, right? And
Yeah.
I felt like when I was at the peak of my career, you know, really comfortable, really good surgeon, great with taking care of my patients. I kind of started this leadership journey and found myself in spaces where I now was the green person. I was trying to learn new language in an administrative world, but saw the value, leaned into the value and the uniqueness that I brought to those conversations and to being in that room. And it took a lot more, my energy, what I was learning, focusing on then was very different than today. And it was a journey. I'm constantly on this journey of building those relationships, of leaning into the value that I personally bring, into being forthcoming with the difficult conversations or topics that we need to address, and being secure enough in myself as both a person and what I bring to the table to not hold back and be fearful as much about like a reaction as much as I would total like failure that I fail the patients, I fail the system in some way. And in the end, I always say I can make these difficult decisions. I'm leaning into this leadership because I know it matters for our patients. And that impact, that's my legacy. I tell my kids, I want them to be able to see the work that I did when mommy wasn't able to be there for X or Y, that it it was because I was able to make a difference in some way. And so leadership is a journey and we're all continuing to evolve. And I would invite all of your listeners to just continue to be that scholar, to continue to lean into this development that we're all doing on an ongoing basis.
Yeah, appreciate that. The journey of leadership is never ending. The learning is never ending. The opportunities to get better never stop. It's good to be confident in your leadership, but you always have to put yourself out there, always have to be growing. And I love that about you, and I love about that about your sense of what leadership is all about. And I see it, I saw it in you as a colleague with you years ago, and I continue to hear it in your voice today. So thanks for sharing your insights with us today, and appreciate your leadership, Pam.
Thank you, Al, and thanks for bringing these podcasts out to share leadership journeys with your listeners. And I'm glad to see you're doing well.
Yeah, thank you. Thanks for listening. Leadership is rarely simple and it's rarely easy, and that's exactly why it matters. My hope is that something from today's conversation gave you a moment to pause, reflect, or see your leadership in a new way. Until next time, lead well.